Imagine having a disease that may cause an itch so intense, some describe it feeling like bugs crawling under your skin. Itching is one of the common symptoms of a rare, chronic, progressive I can't even speak, autoimmune disease that attacks the liver's bile ducts. It's early in the morning, haven't had Starbucks yet. Getting diagnosed is the first important step in managing the condition known as primary biliary cholangitis, if I'm saying it right, primary biliary cholangitis. Here with more are Naveen, who's living with PBC, and Dr. Arpana Goel. Is that correct, doctor? I'm getting something right.
Yes, Dr. Boyle. Yes,
Goal.
you were very close.
So, doctor, what is the primary biliary cholangitis or PBC? What is it?
Yes. So primary biliary cholangitis, it's a long word. That's why we abbreviate it to PBC. So it's an autoimmune disease that means that it's a disease where the body's immune system is attacking the small bile ducts in the liver. It's a very rare disease, and it primarily affects women that are, ages 40s to 50s or so, affecting about 1 in 1,000 women. Over time, with this autoimmune disease, with PBC, if it's untreated, the bile starts to build up in the liver. It causes inflammation, can cause scarring, and that ultimately can progress to cirrhosis and needing liver transplantation if left untreated. So while we primarily are just diagnosing this disease in women, we do see more and more men being diagnosed with the disease now too.
So, what are some of the symptoms of PBC?
The most common symptom that affects about 70 to 80% of people diagnosed with PBC is that of itchiness. And the itchiness is this pretty severe, intense itch that really affects the palms, it affects the soles. It's this itch that really can't be scratched, is how we really hear it described. It prevents people from sleeping at nighttime, and it's not really associated with a rash. And that tends to be the most concerning symptom. People also will complain of fatigue and brain fog. And that's really why we're here today on behalf of the Gilead Sciences to raise awareness of this condition, and especially for anybody that might be dealing with these symptoms regularly.
Speaking of which, Naveen, how has PBC impacted your life?
In many ways, actually. When I got diagnosed, I had very little children, and it was hard for me to explain to them what I was going through because visibly, you cannot see anything what the PBC patient is going through. I would constantly be scratching, and my kids would be sitting around me, and sometimes they would see me bleeding as well. So it was hard for me to explain to them what I was going through. Also, I am a business owner, and it was very hard for me to concentrate on daily chores like sitting through the meetings or even making some decisions because of brain fog. So there are many sleepless nights because of severe itching that would lead to severe exhaustion also throughout the day. And I was all, as a woman, it has been very difficult for me to wear clothing of my own choice because chronic itch would lead to scarring on my body, and I would be hesitant to wear what I wanted to wear.
So, Naveen, how have you faced the challenges of this disease? How have you faced them?
I would definitely say it was hard in the beginning, but I had to change my perspective. I started looking at life differently because I had to live with the disease. So I would say family has been an integral part of me, and then educating people around me, my friends, and my support system about the disease has helped me tremendously. Also, I would say the medical system in this time and day, I was not ready to give in. I tried my best to do my own research and reached out to the doctors. And I would say that I've been blessed to get the right medication and attention at the right time.
So, doctor, what is the final takeaway you'd like the audience to know about, and where can they learn more?
Yeah, really, we want people to be aware that this is a disease and that if you're experiencing any symptoms related to itch and fatigue that are unexplained, to really consider this. A great resource is morethanpbc.com or PBCers. And please speak with your doctor if you want to learn more about it too.
One last question, Naveen. What would you say to other people who are experiencing this as far as friends, family, and support system?
I would say definitely talk to them. Educating them about this disease is very important because nobody can understand unless you tell them. And also reaching out to the doctors and don't give up.
Number one, don't give up. I like that. Naveen, doctor, thank you so much for joining us on Morning Blend and talking about this rare liver disease called PBC. Thank you again.
Thank you.
Thank you.